Well, it's been a year since the H1N1 flu pandemic began in Minnesota. Carol 11's Renee Tessman looks at the past year and finds there was a lot of fear and concern. Some of it founded, much of it not.
So it's crazy to think this time last year you were really sick.
When H1N1 first surfaced last spring, Cretin-Derham Hall senior H1N Stinchfield was among the first to get it.
3 days of just horrible body aches and fever.
She didn't know what it would bring, and neither did her mother, Patsy Stinchfield, who is also director of infectious disease at children's hospitals and clinics. So 1 year after the pandemic began,
what have experts at children's hospitals and clinics and across the country learned about H1N1?
More children of color, more obese, more kids with asthma, and more young children being admitted than adults or any other types of chronic conditions.
And Stinchfield does not think H1N1 was blown out of proportion.
And we really didn't have a choice but to be very prepared for the worst. And we're glad that it was more of a moderate disease and moderate pandemic.
The Centers for Disease Control estimates over 12,000 people have died from H1N1, but that's fewer than the estimated 36,000 killed by seasonal influenza annually. Chris Erzman with the Minnesota Department of Health says you can't compare the two yet because seasonal flu numbers include deaths from secondary pneumonias too.
So we look at linking influenza and pneumonia deaths. And in the case of H1N1, we did very, very specific tracking just for H1N1.
And H1N1 may not be gone yet.
Is that the southeastern part of the United States has seen an increase in cases of H1N1 influenza.
It's too early to tell if it may be a third wave. H1N Stinchfield is just glad H1N1 is in her past. Renee Tessman, KARE 11 News.
Erzman said that about 70 Minnesotans have died from H1N1. Stinchfield says about a third of the U.S. population was vaccinated for H1N1, which helped minimize its spread.